So this is work that we did with CIBMTR over the past several years now, and our question originally was to address the unmet need in terms of donor availability for myelofibrosis. So as has been voiced by many transplanters and many of our colleagues, that they're not very excited about haplodonor transplants in myelofibrosis, worried about toxicity and potentially poor outcomes. So what we did is we went back to the CIBMTR registry, which, as you know, is this plethora of data waiting to be used, and we asked the question how donor transplants do in comparison to matched-unrelated donor transplants or matched-sibling donor transplants. So what we saw, and for reference, actually, before I get there, for reference, I will point out to the 2014 study that was done by Dr. Vikas Gupta, and in that study, the comparison was matched-sibling versus MUDs versus mismatched MUDs, and they showed that the three did meaningfully differently, meaning that matched-sibs did significantly better than MUDs, who in turn did significantly better than mismatched unrelated donors. So in contrast to that, what we showed this time is that haplodonors and MUD donors and mismatched MUD donors, they do essentially similarly in the context of overall survival, disease-free survival, relapse, as well as non-relapse mortality. Matched-sibling donors still appear to have a slightly lower non-relapse mortality by virtue of improved engraftment, and hence tend to have a better overall survival, which is true for the first 3 months. Now, some of this appeared to be confounded by the fact that people were waiting too long to use haplodonors to get to transplant, and that was evident in the time to transplant comparison. So we looked at a smaller subset in that cohort of patients who underwent a transplant within 2 years of their diagnosis to get rid of that bias of waiting for transplant too long. And in that subset, there was no difference whatsoever in overall survival between the 4 donor types. So essentially, what we hope to promote via that study is that there is a donor for everyone, and lack of donor availability hopefully should be less or never a reason to consider transplant in an otherwise person in need for an allograft for myelofibrosis.